welcome back. Our first conversation, as we mentioned earlier, is all about World Pediatrics and bringing specialized care to Belizean children. In studio with us this morning is Milagro Garel. She's a Senior Managing Director at the World Pediatric Project. Good morning.
Good morning.
Good morning.
And she is joined by Mark Daniels Jr. He's a Standard 1 student at Holy Redeemer School.
Yeah.
And
Hi.
good morning, Mark.
Good morning.
How are you feeling?
Good.
Good? We're here to talk all about World Pediatrics this morning and the work that you guys do in helping children like Mark. So let's start there, Milagro. You've been with the World Pediatric Project for quite some time, and you've seen children with various conditions come and go, and you've rendered the kind of assistance that they've needed, in many cases, life-changing assistance. Let's begin by talking about the work that you guys do.
Good morning, and thank you for having us. It's always a delight to be in your company, and we're so pleased to share information about our organization. I love the fact that we were able to get Mark here. He's one of our superstars. What we do is we bridge a gap to bring surgical care to children who otherwise don't have access. And we work in the Caribbean, in Belize, of course, Latin America and Central America.
Yeah. Now, as you mentioned, World Pediatrics is a global organization. I've been able to learn a bit of the work that you guys have been doing for the past few years, having covered some of the stories as well. And so I understand that it's been just about 25 or so years since it has been established in Belize.
And that is why we want to promote ourselves even more so, because this year we are celebrating our 25th year of existence. Globally. So we are so excited. We're so privileged that the families trust us. You know, they put their trust in us. They don't know us, but they actually trust us to care for the children, to find care, to send to resources that we already have. And it's just awesome, you know.
Let's step away from, well, and it's difficult to divorce the two, but I want to get a bit personal in my line of question with you, Milagro, in terms of this being your life's work. How did you come by, you know, that love for working with children in these situations?
So Isani, you remember Rowan very well.
Yeah.
We did many challenges with Rowan, and Rowan, so I know exactly what it is to need surgical services, and it's not available because my son is 27 years old now, and he needed services, and he wasn't able to access that. So, you know, we had to do it privately. And so that's why for me, working with World Pediatrics, yes, it is a job, but it's more a passion because I've been on that side of the fence. So I know what it is for families that lay awake at night and don't know where they're going to get surgical life-saving access for their children.
It hits closer to home for you. And that's I think, even more of a driver when you know what that feels like. You push even harder to help people as well. Now, we have joining us in the conversation as well, Myra Singh. She's the Belize board chair and just also one of those persons who have followed the journeys of several of these children in World Pediatrics, getting the care that they need. In just a few, I'll also take things over to Mark and learn a bit more about his story. But Ms. Singh, can you talk about what your contribution has been being a part of the board and trying to provide support to these children and getting care for them?
Well, that's 25 years. I've been involved with World Pediatrics for 25 years. I was one of those high-risk pregnancies, and for me it was a calling. You know, I think by the grace of God, I was asked by my pediatrician to become part of this organization that was going to partner with what was then International Hospital for Children, now World Pediatrics. And like I said, it was a calling. It was divine intervention, because I always thought I was blessed with a healthy child, and I thought I needed to give back. And when he told me that's it, that's what I need to do. And I've been involved with, my son has just turned 25, and really it's been 25 years of this. I call it labor of love. And I started as a volunteer and always loved doing the volunteering. There's nothing more satisfying than seeing a child heal And not only that, when you see the people that work around it, me as a volunteer, I felt elated that I was part of these, miracles. I call them miracles too. And being part of it and seeing the children healing and coming from where they were to, where they go, and the parents' faces when they see their child being taken care of. So that is all very fulfilling. And my contribution to it has not only been, sponsoring it through my husband as well. We've been involved with World Pediatrics and Friends of Pediatrics and what was originally International Hospital for Children, because we care about our children, and overall, if we take care of ours, we can take care of the world, and that's exactly why, what our slogan says, heal a child, heal the world.
So one of the really, I think, cool things worthy of mentioning is a point that you mentioned to me in the past, Ms. Garel, about following the journeys of these children. It doesn't stop at that first medical aid that they would get. You follow along their journeys until they're completely good enough to stand on their own. In the case of Mark Daniels Jr., I want to quickly talk about when you met Miss Garel, or when you perhaps were introduced to World Pediatrics. Mark, when did you learn about World Pediatrics?
I forgot.
You forgot? Okay, so let's take it maybe even a step back more. Mark was diagnosed with clubfoot and spina bifida. Do you know what that is, Mark?
Yeah.
Could you explain what that is?
Spina bifida is like your foot is just turned.
Okay. So your foot is turned.
Yeah, then they had to get surgery.
Okay. How were you born this way? Okay. So, Ms. Garel, could you talk about the point that you guys met Mark and when that journey with him began?
And of course, Mark doesn't remember he was a baby. And now Mark, how old are you, Mark?
8.
Mark is 8 years old. So just from going back to the point that you just made, it shows that we're not here just to do an evaluation at one clinic when the teams come, when the groups come to evaluate the children. We're here for the long term. Spina bifida is not going to go away. Mark is going to be a spina bifida patient into adulthood. And we are here to guide the mom, to offer support for all his care. There's bladder issues. There's so many other issues besides the leg, and neurosurgical issues or neurological issues as well. And we are here for the long haul to guide them, to manage, to monitor, to evaluate, to assist when they need surgeries. We're also there. So it's a long process that we don't just give up on the children.
Is that how most of your cases are given? You find them at the hospital as a baby?
So at the moment, because we are doing a bit more promotion on social media and stuff, it's not as difficult to get the word out, especially in the regions, because as you know, a clinic in Independence, a clinic in Stann Creek or whatever, it's more difficult for them to know the resources that are here. So the physicians are the ones, and the hospitals, they are the ones who are sending us the referrals, which is a beautiful partnership now. There's other organizations as well, like Mark would go to some PT at Inspiration Center. So we have partners that we have collaborated with.
How do you pair the children with the physicians who come in every so often?
Well, I'll tell you the truth, that's a lot of trial and error, because I am not a physician. And but because of the experience that we have, we now know which specialty the patients need, and we go along and we learn. But in the beginning, it was even difficult even for the patients. And just to show you how long we've come, because I'm sure that Myra can remember that we used to go to a clinic in Dangriga for plastic surgery, and then we would have a patient that come with urology needs. And they've traveled so many miles, an entire day, and then it's not the right fit. That doesn't happen, hardly happens anymore.
Well, I want to learn a little bit more about Mark. Mark, you are in Standard 1 at Holy Redeemer Primary School, right? Tell me a little bit about yourself. Do you have a lot of friends? So tell me what you like about school.
School is fun.
What else?
It's fun to learn.
You like to learn? So do you, I know that you are confined to a wheelchair, but what do you do when you're at school aside from learning? Do you still have a lot of friends and play and stuff like
Yeah.
that? Okay. Now you said that you remember now. What do you remember about World Pediatrics?
When I was born, my mom told me I didn't cry, so my mom told me I was sick.
Oh. And when
Because as a baby, you are supposed to cry when you deliver.
Usually,
oh. Do people ask you about your condition?
lots of times.
Yeah? And how do you go about explaining to them?
I didn't tell them.
You don't tell them? So when they ask, what do you do?
I didn't tell them anything.
You don't say anything. Do you ever feel like, I don't know, like it's harder for you to adjust to life because of your situation? How do you go about still trying to create a sense of normalcy? How does World Pediatrics or maybe your mom make sure that you still feel like, you're included?
She takes care of me.
Okay.
Very good care of you, right?
Yeah.
And his school gives him a lot of support, like they include him. Mark participates, he reads. He's being a little shy right now, but he sings, he reads for us, he does ads. Anything that you ask him, he speaks eloquently. We're so proud of Mark.
Yeah. Yeah, he's not shy at all. We were getting the introduction before, just about a few minutes ago. But I want to go back to the celebration of 25 years and what that means to you guys as well. There are so many children who have come through this organization in that 2.5 decades. And of course, many, many lives and stories as well coming out of this organization. Ms. Garel, Ms. Singh, talk about what that means to you guys, knowing that you've been along the journeys of these families, not just these patients, but families as well, and you continue to provide that support.
I would like to, so that everybody gets the gist of what difference we have made in Belize, because a lot of people talk like I try to get funds raised in Belize now, and they ask what has the impact been.
Yeah.
And we also have to show the ministry and the UNICEF partners what does this really mean. And what this means is that we have different types of programs. And so we have teams that come in, we have children that go to the States, we have, since COVID, started doing regional sponsorship. So we, at the moment, I have a baby who is suffering the same thing that Rowan had, retinopathy of prematurity with the eyesight. We accepted that child in Guatemala within 2 days. 2 days, and that child is there, and everybody can keep the baby Leon in prayer because he's undergoing surgery today.
Oh, nice.
So that is just the efficiency of the having the regions access as partners for us, and we're able to collaborate with them.
So I have some statistics here that I just really quickly want to put into perspective, perhaps. Since 2001 to this point, so that's just about 24 or 25 years if you count 2026, you guys have provided 177 care to children in the United States or regionally. That accounts to, in Belize, $43 million, 178,955. That's a lot of money, and that's regionally in the United States.
Yes.
In Belize, care has been provided to 142 children, valuing up to $103,224. Now, there are so many surgeries that were done in that time span as well. 197 surgical and diagnostic teams visiting Belize, providing that care. A lot of these children, without that diagnostics or these teams visiting, would not know what their situation is, or their families would not know, because a lot of these families, they would just have to be, sitting in their situation, not knowing how to provide that support to the children, or trying to find other organizations that would be, providing support like that. A total number of individual children served to date since 2001 is 4,136. That's almost 5,000 children, 5,000 families being impacted as well. And of course, we have one of those children right here with us, Mark Jr. Wow, that is beautiful. A total value of services provided in Belize dollars, over $65 million.
Absolutely.
Wow.
Powerful.
So that, yes, so you know how people say numbers are so boring and all of that, but this is the impact.
Nothing boring about that.
This is the impact, and that is why we ask that if you know about us, you have been impacted by somehow or the other by us, families that have been able to benefit. We want you to share the information. We want you to share our number. We want you to say, this is my experience. And if it wasn't such a good experience, we also want to know, because we want to do better. We always want to do
So I
better.
have a question for you ladies. You've been involved with World Pediatrics for all these many years. Is there any one child, or is there perhaps any group of children who have passed through your care that have gone on to do great things, notwithstanding their conditions? Can you remember anyone who?
Talk about my
Sorry?
goddaughter.
I'd love
I have to
to.
talk about my goddaughter.
Sure.
With spina bifida patient. She's now married, have a child, went to college. Things that you would never think, they might have done or they could do.
Yeah.
But that child was taken, we've been taking care of her. I was actually the inspiration to bring in these clinics. We got very much involved. I personally got involved and actually became her godmother after that. But to see the family, how they, it's amazing what we've been able to assist with this child, to get through, the childhood, all the ordeals, going through high school, all the ordeals that, young girls deal with, and to get to where she is right now, having had a child, I think that's major.
is.
So that's a child that she's 22 now,
Nice.
and has accomplished so much. So yes, by the miracle of, World Pediatrics and God, that's where she is. So I can proudly say that that's a good example. I mean, we have so many, but I just needed to take that one because we've seen her from birth, from she was born to now, she herself having a child, and even worrying if she was going to have a child with that same condition. But thank goodness and thank God, everything was good.
And she was well guided all along. She had someone that she could speak to, not her gynecologist. I'm speaking to someone in the organization that she felt confident over the years. That relationship had grew, and so she knew that she could just send a message and someone would answer her, to make sure that she could put her mind at ease.
Just as of the other day when she was about to have her baby, she's talking to us, to the organization, to the nurse that had taken care of her throughout, her earlier days.
And an important point right here that I wanted to say is that if you have insurance, and you're going to go to the hospital to get the paperwork for her, to get her medical records, to be able to then get insurance to be eligible. We were able to provide that, and within the same day, we had the entire packet for her. Her insurance company asked how come she had access to that efficiency.
I really quickly want to identify some of the areas that you guys provide support, though, because I imagine there might be people tuning in right now wondering, what can I go to World Pediatrics for? You guys provide a range of support aside from surgeries, which you might learn there are a lot of people going out in the region or in the United States getting surgeries done, but you also do non-surgical treatment as well, consultations, evaluations, medical supply, imaging. Travel is also included. For a lot of these families, I imagine they don't even know how they can leave the country in the first place. We can perhaps talk about that in just a moment. Lab testing services, prosthetic deliveries, prosthetic care, all of that are just surgeries also provided by World Pediatrics as well. When we talk about accessing World Pediatrics and trying to figure out how I can begin this step as a family member, as a patient, how does that process begin?
Just a simple phone call. We make it very simple, and we can do things online that you don't even have to come to the office. So we are located at 3581 Sunrise Avenue. We have our social media page, World Pediatric Belize. Our number is in the phone book, or if you Google our number, it easily comes up, and or send us a message on Facebook or WhatsApp, and you share my number, so you call the office and we register the patient, and then we tell you the steps necessary to enroll that child depending on the condition that they have. So for example, you ask what types of conditions do we treat. Mark with clubfoot and spina bifida, he gets care from us and we don't charge, his mom doesn't have to pay anything to us. So clubfoot and spina bifida are non-surgical. Sometimes they become, and that is how we decide where we go and what types of care we need because of the children that come to us. So it's all a form of orthopedic surgery. We offer any type of specialized orthopedic surgical care. And then, well, as I said, clubfoot and spina bifida are a type of that branch off from orthopedics.
Is there any point that families might have to pay something to get this type of service?
Yes, because we have the families pay for like transportation to Belize.
Okay.
If they can cover something, because we feel that it's a collaboration and they have to have some type of onus.
Yeah.
You know, and they have to recognize the value of what it is that we get, because if we give $50,000 for the surgery, they must be able to come up with a little bit of money for their personal expenses. Like while they're going through the airport, it's not like, you know, we cannot penny pinch and say, I can't buy a Coke because you said it's not going to cost me anything, you know?
Yeah.
So.
All right, well, let's get to the fundraiser that is about to take place, celebrating 25 years of World Pediatrics here in Belize. What are we raffling?
So we ask the public for their support. And if you don't believe in raffle, you can still donate to us. We started last year an annual raffle, and it goes towards direct to children in Belize. And this year we're raffling $12,500 and 5 other prizes: overnight trip to San Pedro, a shopping spree, and adventure packages. And it's $50 only for a ticket, and it's going to be raffled in ending of May on a Saturday. And seriously, this really helps a long way, because for the lab tests that you talk about, the little medications that the family can't access, this is what we're hoping that we can get the sponsorship and support from the Belize communities.
Yes. All right, well, before we wind down this conversation, how can people get the tickets? How can people purchase the tickets?
The same by contacting our office, or 610-2606 is our number, 223-7300 is our another office number, and WhatsApp, social media, or come see us at 3581 Sunrise Avenue.
All right. I want to go back to Mark and ask if you want to say thank you to anybody. You know, you've had World Pediatrics on your journey with you since you were born, but do you have any special thank you would like to share? Who you want to say thank you to? Let me hear it. Why you want to say thank you to them?
Because there's the best people in the world.
Excellent. All right, there you go.
Thank you.
You're the best.
Well, guys, this has been a wonderful conversation. Thank you so much for joining us this morning, sharing some statistics or data on the impact of the work that you guys have been doing for the past 25 years. We see it in the children, and of course the numbers, they don't lie. Again, please support World Pediatrics. The raffle tickets are only $50, and aside from winning $12,500 and many other items you can walk away with, you're also supporting something that is benefiting thousands of children, almost 5,000 in fact here in Belize, and even more worldwide. At this time, we are going to move into our weather update, Isani. I know that it has been a little bit chilly, but let's see if, yeah, and wet as well. Let's see if it's going to continue. Here's our eye on the weather. All right, this is our Eye on the Weather, brought to you by the folks from the National Meteorological Service. Today's forecast calls for sunny skies with cloudy intervals. Tonight's skies will be partly cloudy. A few showers will continue to develop mainly along the coast during the morning and afternoon hours. Tonight's showers will become isolated as well. In terms of temperatures, coastal areas can expect highs of 82 degrees Fahrenheit, then dropping to lows of 72. Inland, very similar temperatures, highs of 85 degrees Fahrenheit with lows of 66. And then in the hills, highs of 76, dropping to a chilly 59. I'm jealous of you guys over there. In terms of our extended forecast, Friday through to Monday, inland and coastal areas on Friday will be expecting temperatures of 82 and 85 for highs, then dropping to lows of 74 and 68. On the weekend, Saturday and Sunday, inland and coastal areas can expect highs of 83 and 86, dropping to lows of 74 and 67, 83 and 87, dropping to lows of 74 and 67. Then on Monday, highs of 83 and 88, dropping to lows of 74 and 67, again for inland and coastal areas. The sea state is light choppy, with winds blowing from the east to northeast at 5 to 15 knots. Today's high tide will take place at 8:03 a.m. and then a low tide at 11:49. There's a 111. Some people might say make a wish. And another high tide will take place at 6:18 p.m. and then another low tide tomorrow at 2:25 a.m. And that does it for our weather forecast. We have a repeated slide here, and that really just says what you can expect from Friday through to Monday. But this weather forecast was brought to you by the folks from the National Meteorological Service. At this time, we take another quick break, but don't go anywhere. We'll be right back with more on Open Your Eyes.